Stop sharing my screen and get our introduction ready for our next presenter because we are rolling and going. So it is my honor to introduce our next presenter, Dottie Stafford. She is the statewide advocacy director for Georgia Network to End Sexual Assault, where she oversees the development, execution, and technical support for Georgia sexual assault centers. I urge you all to read her full bio on our conference app. And in the essence of time, I will go ahead and welcome our speaker, Ms. Stafford. Thank you so much for joining us. And I am muting my mic.
Hey everyone, I feel kind of like a floating head here. Zoom is such a weird thing. I don't normally get nervous talking in front of people, but I'm a little nervous today, so I'm going to pretend there's only two of you out here. So I'm going to go ahead and share my screen. Let me make sure I get it all right. Okay. Bring our video panel back up. All right, so I really appreciate the opportunity to be here today to speak on this topic and to be with such an esteemed group of people who are looking at bettering our communities. So my topic is sexual assault in the breastfeeding mother. So we have to first recognize our pioneers of Zoom. Of course, the Brady Bunch was our first little look at Zoom, and we never knew how important it was going to be to us these days. So again, my name is Dottie Stafford. My pronouns are she and her, and I am the statewide sexual assault / advocacy director for the Georgia Network to End Sexual Assault, which is Georgia's Sexual Assault Coalition. If you would like to take a picture of the screen, I know you'll have access to the handouts and things like that. But if there's anything that you need, feel free to make contact with me. First thing that I want to acknowledge is that, there's a trigger warning involved in any time we talk about sexual violence. So I want to encourage you to really take care of yourself. Your safety is utmost concern. If the material is too much, I encourage you to practice that self-care. Think about who you can talk to after this presentation is over, after your conference is over for the day, and plan a self-care activity for later on. Anytime we talk about difficult topics, it's really important that we do practice self-care. Because there are possibly many survivors in this audience, and I want safety to be the utmost concern. So when we talk about sexual assault, it covers a wide range of different unwanted behaviors, and the key here is unwanted, that are attempted or completed against a victim's will, or perhaps the person is unable to consent because of their a disability, or they're under the influence of alcohol or drugs, or because they're under the age of consent. So in the training that I'm doing, we'll use the words sexual violence sometimes, rape sometimes, sexual assault, but kind of looking at that umbrella. So sexual assault is generally any non-consensual sexual contact between two or more people. It usually involves the sex organs of one or more persons, but it doesn't have to include the sex organs. It happens regardless of gender or marital status, with or without penetration, with or without physical contact, but it does usually involve some sort of vaginal, oral, or anal contact. And that could be a wide range of things from catcalling to gang rape, sex trafficking, fondling, date rape. There's a wide range within that umbrella of sexual assault. And then we also are probably in this forum dealing with child sexual abuse as well. And that's any interaction between an adult or child that is for the satisfaction or sexual stimulation of the perpetrator or an observer. And usually when a child is being sexually abused, the person that's doing that abusing is grooming them. They are, doing things to gain that child's trust or the family's trust with the intent of being sexually abusive. And it is usually someone that is known to the child, which increases that level of betrayal that the victim feels as a result. So in grooming, someone looks to target a victim, looking for perhaps a child who is under-resourced in some way. They may be having difficulties at home. They may be in foster care, but they're looking for someone who they can exploit. And securing access to that victim, gaining the victim's trust, and then controlling or concealing that relationship by saying, this is our secret. If you tell anyone, I'm going to harm your family or your pet or whatever the case may be, or your family won't love you anymore. And while mostly we're focusing today on sexual abuse or sexual assault against females in the breastfeeding area, it can happen to anyone, regardless of your gender, your sexual orientation, sexual identity. Sexual assault is something that does not discriminate by race or socioeconomic status, religion, national origin. It can happen to anyone. And males who experience sexual abuse have other challenges because of social attitudes and stereotypes about men and their masculinity. And it can be difficult for anyone to reach out and get help and report, but it's even more challenging for males as well. So we'll have some resources at the end that kind of talk about, how, where to go for help. Right. So looking at trauma, each person who experiences trauma is it's unique to everyone. There are some very big similarities, but how you handle that trauma is a result of your individual makeup, your access to resources, your culture, your past experiences, any number of things, what access you have to different coping strategies. Those all impact how someone will react to a trauma. And as we know, many people don't report having experienced a sexual assault, whether it's they're afraid that someone will judge them or make them feel like it's their fault, whether they're not going to be believed, if it's scared to go to law enforcement about what happened. There's so many reasons why people don't report. So we have to acknowledge that when we're working with people, that they may not be willing to tell us what's going on inside of them. So we have to kind of look for the signs and things to be able to offer that kind of support. So when breastfeeding and experiencing some sort of sexual trauma, a wide range of things can happen from breastfeeding. One person may feel like the breastfeeding experience is incredibly healing to them, while another person may experience more trauma as a result of the breastfeeding process. And it could be that the physical pain involved with breastfeeding at the beginning is something that's a trigger, whether it's, nipple pain or an infection in the breast ducts, or the milk ducts. It may be that, when the baby's teething, those can trigger some pain. And in turn, they experience some flashbacks. Even skin-to-skin contact and the sensation of expressing that milk can be a trigger that can cause a flashback in a person. And we also know that the process of giving birth and breastfeeding can make someone feel like they are not in control of their own bodies anymore. That process that happens. And that's why it's so important for people like you who are supporters of breastfeeding to be there and let them know that they do have control over their body. They have choices about what's going on. They have support as they go through this process. That is just an invaluable part of what you do. So, when someone feels like they've lost control, it makes them feel helpless. And so, being there as their support is important. And also, experiencing postpartum depression, it can increase when there is a history of sexual trauma. So rape victims are 3 times more likely to experience major depressive episodes than those who have not been abused. So, you add in that stress of being a new parent and a breastfeeding mother, and that increases the stress that someone feels. And people may not want to ask for help. So, we know that being parents can be overwhelming, and trying to meet the needs of a child, meet the needs of a partner can all be very overwhelming. So, it's even more difficult to ask for help at times. So we need to be able to look for the signs of what might be going on with someone. Whether you notice they have increased anxiety, a fear of being touched, an exaggerated startle response, signs of depression, trying to isolate themselves, dissociation when you're working with them or when they're breastfeeding, them experiencing panic attacks, suicidal ideation, a fear of their partner, or there's limited communication with the mother because partner won't allow her to speak freely. And then also distrust. So looking for some of those signs that are beyond just what the hormonal changes are after experiencing pregnancy and a birth. So this is just a little thing about the anatomy of a panic attack and how, your body reacts to experiencing a panic attack. So it's important for ourselves to practice self-care, but it's also important to talk to new breastfeeding mothers about how can they, while they're meeting the needs of their baby and their other children and whatever else is going on in their lives, how they can still practice some sort of self-care along the way. So we also want to look at the intersection of domestic violence and sexual assault. When someone is in a relationship and their partner is being physically violent to them, chances are they're also being sexually violent with them. Victims who are both physically and sexually abused are more likely to be injured or killed as a result of one of those forms of abuse. And women who are disabled, pregnant, or attempting to leave their abuser, they are at the greatest risk for being hurt or being killed. And so if we think about sexual assault within a domestic violence concept, you think about this is probably not just one incident of sexual assault, it's many incidents over time where that person has experienced an unwanted sexual contact in that relationship. So during times of pregnancy, intimate partner violence may begin, or it may actually intensify, which seems counterintuitive because if you're looking at, someone is having your child, it's supposed to be a happy time, but that's not always the case. And the pregnant mother may be focusing more on the child, or the new mother may be focusing more on the child. They may be less likely to breastfeed because that attention is being given to the child instead of to the partner, and there are consequences for that. So looking at domestic violence in pregnancy, it can lead to complications, preterm birth, placental abruption, miscarriage, stillbirth, death of the mother, and a lower likelihood of actually breastfeeding. So I want you to, remember to check in with yourself, because when we talk about stuff like this, and, I have a 30-minute time frame, so I'm trying to talk kind of fast. But I want you to stop and ground yourself. So I want you to think of 5 things that you can see in your room or outside of your window. Focus on 5 things you can see inside of the room where you are or outside of your window. I want you to concentrate on 4 things that you can feel. Maybe it's the silkiness of your skin, the texture of the material on your chair, your hair, um, whatever's in front of you to touch, even the table, the computer. 4 things that you can feel. Think about 3 things that you can hear. Maybe it's the traffic outside, an ambulance going by, the birds singing, the hum of your lights or your computer. But think about 3 things that you can hear. And then about 2 things that you can smell. Hopefully it's not going to be anything awful, but 2 things that you can smell. Maybe it's the leftover breakfast that you were cooking or the air freshener that you've got in the room. And then think of 1 thing that you can taste. Maybe it's candy, maybe it's chocolate, because whenever you talk about hard stuff, there should be chocolate that's involved. But, you know, it's a good time for you to kind of ground yourself and use these techniques to help ground the person that you work with. Because, you know, we're all dealing with difficult things. And when we take just a few moments to look at these kinds of things to ground ourselves, we can give ourselves perhaps that break that we need to be able to move forward. In turn, I also want you to talk to yourself like you would talk to someone that you love. We are our harshest critics in life. We wouldn't think of talking to someone else the way that we talk to ourselves. So to remember to treat yourself with love and speak to yourself the way you would someone that you love. And to remember that self-care is a priority and a necessity. It's not a luxury, especially in the kind of work that we all do when we're trying to help others. It's not a luxury. So we're not going to watch this video because it's a 2-hour video, but this is a video by Dr. Jim Hopper, and he talks about the neurobiology of trauma. And I would suggest this video to really understand the way that trauma impacts people. You know, it could be very helpful in the line of work that you're doing to be able to do that. So just, you know, Google searching Jim Hopper, neurobiology of trauma will take you to that. All right, Jim, we'll move forward. All right, so we think about how to help. So if you're helping someone who has experienced abuse in the past, it's important to educate yourself. It's also important for you to remain calm if someone discloses abuse to you. Listen to them, be non-judgmental, guide them to resources in the community that can help. Focus on their strengths, how they survived. You know, you seem like such a strong person. The things that you've told me, you have gone through so much, and yet you're here. That shows incredible strength. Doing a safety plan with that person, whether it's an emotional safety plan or a physical safety plan. Share those strategies of, you know, how do you help someone? You know, if you have experience in working with this, you know, share strategies that may work for them in continuing their efforts to breastfeed. Ask how you can provide someone support. You know, that's the best way. What has helped you in the past when you have been experiencing difficult things? And to normalize getting help. You know, we could all use somebody to sit down and talk to. And that's what therapy is just somebody to sit down and talk to. So they may disclose to you and you guide them towards someone who might be able to provide even more support. So again, you know, helping them develop a support system. Who in your life has been supportive for you in the past? Now you've got our organization who's going to continue to support you, and I can connect you with other resources to be able to help. Encourage them to practice self-care. believe that person. It's not our role to judge or to be investigators in what they're saying. Our role is to believe them and to thank them for sharing with you and having the trust in you to be able to share, and also showing them great empathy, being patient with them, always asking before you touch someone. Explain what your actions are going to be. If you're helping them to be able to get the baby to latch, make sure that you are, asking if you can touch and explaining what you're going to be doing, and maintaining appropriate boundaries with people. So again, learning to normalize their concerns. I feel kind of like I'm the only mother out there who can't do this because of trauma. Well, there are a lot of people who experience trauma, but with the right support, we can help you to meet whatever your goal is with breastfeeding. Respect their decisions. Don't diagnose someone. We're not there to provide a clinical diagnosis for their depression, but saying, I see that you're exhibiting some symptoms that a lot of people have when they're feeling depressed. Here's a resource that might help. Helping them to establish boundaries, set a relaxing environment for the person, and brainstorm ways to help improve their experience with breastfeeding. Someone who is experiencing current abuse, if it is an adult, again, connecting them to resources so that they can get additional help is important. So we're going to look at some of the resources. And one is the National Sexual Assault Hotline. If someone calls the 1-800 number for RAINN, it is going to direct them to the local rape crisis center wherever they are. So this is a great national number to be able to have. They have lots of great information on their website, and they have it in English and in Spanish. And also they have an online hotline. And that online hotline, they can get, they can work with someone in a chat. They may not feel comfortable talking, so they can have a chat with someone to talk about what's going on. They also have a military helpline. So if someone is in the military, there are additional resources that they may be able to get towards that person if they are military. So this one just tells about the online chat with a trained staff member. Okay, the Georgia Network to End Sexual Assault is Georgia's Sexual Assault Coalition. We have a website. On our website, it has a list of all of the rape crisis centers for Georgia, contact numbers for them, what counties they serve. So if you know that a person that you're working with is in Bibb County, you can look on there and find Bibb County, and you'll know that the crisis line in Safe House of Central Georgia is the rape crisis center that serves Bibb County. So you can refer that person to that. But again, if they call that 1-800 number, it's going to direct them to their closest rape crisis center. So also for the National Domestic Violence Hotline, they also have the chat feature. So if someone's experiencing domestic violence, they have that option as well. There are people who may want to leave, but they're worried about, what am I going to do with my dogs? I can't take them to a hotel or to a relative's house. I need extra help with that. There's an agency called Ahimsa House out of Atlanta that they help throughout the state with being able to board people's animals. They boarded horses and goats and pigs and all kinds of animals, dogs and cats, to be able to make sure that the survivor can feel like they can leave their home and not leave their pet behind. The Georgia Coalition Against Domestic Violence also has a list of shelters by the city that they're in. Georgia's Child Advocacy Centers, there is a list that has information about the county and then how to get in touch with a child advocacy center in that area. United Way 211 is also a great resource. And 211 is a statewide program, but it is divided up into service areas. So again, let's use Bibb County as an area, then they would be United Way of Central Georgia. But all United Ways have a 211. They help find people who have utility, if you need utility assistance, the numbers for food pantries, homeless services, tax services, counseling services, all kinds of stuff like that, even holiday assistance. They can link you with resources. And most of those websites for 211 will have a way that you as the service provider can log onto it. You can print out a resource to be able to hand the person that you're working with that has, you know, these are the food pantries in your area, these are the days of the week they're open, and here's their numbers. So you can hand out those resources to be able to help someone. So we have other agencies like Raksha, who works with people who are South Asian, Comunidad Latino, Georgia Asylum and Immigration Network, and Men Stopping Violence. So, you know, the last thing I want to talk about is safety planning. And if you call a domestic violence service, they're going to be able to help with safety planning. Just because someone calls a domestic violence shelter or a sexual assault center doesn't mean they have to take any kind of action. You know, they can get more information about what their choices are. So looking at emotional safety, again, look at who is their support network, who do they feel comfortable enough going to for support. Combine a list of actions that have worked in other situations to help them when they need stress reduction. Practice techniques for grounding, identify small achievable goals that this person can meet. Create a peaceful space around them, help remind them of their inherent value, remind them that they deserve kindness and to be treated with love and respect, and that's the way that they would treat a friend. Give them numbers for crisis support, and discuss realistic self-care options. When looking at finding safety for someone, asking them, who can you go to for a safe place to stay if it was needed? Also, you know, if they're looking at going into a shelter, you know, what kinds of things that they can expect from that. Telling people, you know, if they're in an environment and an argument starts, look for a place in your house that has more than one exit. Don't end up in rooms like the kitchen, because there are more things that are lethal in the kitchen, like knives or pots or pans to hit someone with. But, you know, looking into, you know, keeping an emergency phone somewhere. Any cell phone that has power can dial 911. So looking at them with them about, you know, if their partner leaves, you know, getting the locks changed on the house, considering a temporary protective order. Family violence centers in Georgia, domestic violence shelters, can help them get a protective order against the person that is being abusive. So, and even if they call and ask questions about a protective order, they don't have to move forward with it. It is all about what their choice is. So, you know, looking at some of those safety things, and, you know, offering to be there to support them if they want to talk to law enforcement or make a report. So that kind of goes through it quickly. So I want you to, again, look at what you can do positive for yourself after this presentation today. Look into what other trainings that you can take about this subject matter, if it's something that you want to get involved in. I just appreciate everything that you guys do to support breastfeeding mothers and others. I know that the Robes group does a great support for the brothers who are in this. So thank you again for your time. I'll be looking at the chat to see if there were any questions. I do have another presentation like right after this one, so I'm sorry I can't stay, but I'll try and pop back on later.
Thank you so much. We appreciate you. And you can also just join in through the WOVA app. So we do want to honor that you do have another obligation. There were some questions. We'll be sure to post it in the WOVA chat for you as well. So when you get an opportunity to, you can connect there.
Send me information on how I do that.
I will. Did you
I
hear
don't
that?
know how to do that.
Calling into Caleb. We'll make sure you are added in. And thank you again so much.
Thank you.
Now I'll bring up Mama Buzz.